she is really stressed because her dog tried to bite me, and this is the first time he's ever done that. But he was to his point of stress.
Yeah.
But she's having a really hard time, and now she's getting a trainer involved because she can't have an aggressive dog. Like, so then it's those kind of situations that just escalate, and they don't need to escalate.
And sometimes kittens, how young they are, they need help to stimulate to go to the bathroom.
Yes.
How the mom does it, licks the bungholio around that with her tongue and tries to stimulate it. Well, apparently this owner did it with her tongue. I'm not making this up. This is a story from, but yeah.
Okay. Hello, everybody. Welcome to the Roundtable, the Veterinary Roundtable.
It's us.
The podcast where we answer your veterinary-related questions while having some fun along the way.
Wow.
We're winging this episode.
Yeah, if you can't tell.
So we have no itinerary. We have no Dr. Emily King. It's just me and Doug.
Free balling.
Yeah, so our producer told us no itineraries. We're just talking.
Yeah.
Like
and
a
we were
normal
told
podcast.
to shoot the ish when it's hilarious because Courtney and I do all the time. So we're just going to see what we pull out of our butts today. I don't know.
Okay.
But we're going to still follow somewhat of what we know.
Yes. So no updates on reviews because we don't have a piece of paper telling us.
We have 1,000 reviews. Wow. Good job.
That'd be cool. Our social media.
Yeah.
Instagram and TikTok at the Veterinary Roundtable. We also have a YouTube where you can watch us if you don't want to just listen.
Yep.
The Veterinary Roundtable.
Watch Courtney's vlogs because she's doing great.
Watch Courtney.
It's basically a Courtney show because she's really good at posting.
The Instagram stories are just Courtney's life.
I was told I need to increase mine, but I just have nothing interesting or I forget.
That is a total lie. You need to work on your Instagram stories. People want to see your boring life. Please.
I'm starting to get in the habit of it's in my brain all the time. Because even the night before, Miles anal landed on the couch. I was like, I gotta get my phone out. I didn't because I was so worried about cleaning it.
Yeah.
But I'm like, this would be kind of funny. But I was like, no, it's fine. I just need to clean the couch and be done with it. But
yeah, Charles.
Once you get the mindset, I think it gets a little bit easier.
He's like, all you gotta do is take your phone and walk out to your horses and talk about your horses. I was like, okay.
Yeah. It's also hard though when you have a baby that you don't want to show and you're with your baby all the time.
Yeah. That's why I was like, my life is a mom right now and my kid is not on social media.
Yeah. So that makes it a little harder.
That's okay. I'll think about it. I'll get better.
She'll get better. It's fine. You heard it here. Hold her accountable.
I can vlog my pit today, which is getting my boobs squashed between a machine.
You want to film that?
I mean, PG. My pit today is I have to get a mammogram.
The joys of being a woman.
I know. Everybody, all the women out there.
Yeah.
Make sure you just stay up on your routine body health.
Yep. It's important.
Yep. I get one every year because of my sister's history of young breast cancer. And so doctor said, sign you up. I said, sign me up.
Yep.
So we ain't missing a mammogram here.
Yep. I don't blame you.
Yeah. It's going to hurt.
Mental health, physical health, all the health is important.
That's right. That's right. Well, I guess that's my pet.
Yeah. What's your peak? Okay. Jumping right into pits.
I know. I guess we're jumping right in. See, this is what happens when we just go for it.
We're just flowing.
Well, I just knew that was my pit. So you go and then I'll think about my peak.
Okay. Oh, my peak was I forgot to mention it last week. It was the week before. I did my first thoracocentesis.
Oh, yeah. No,
I did not do a thoracocentesis. I didn't do that.
She's lying. Everyone, she's blatantly lying right now.
My brain is not okay.
A pericardiocentesis.
I know. I was kidding.
Same cavity.
I did a pericardiocentesis on a cat. It was a deceased cat, but I still did it.
First try.
Yeah, I was practicing.
Yeah.
And I got it my first try, and it was really fun.
Yep.
It was cool to see.
Yeah.
So that was my peak. My pit. My pit is the damn birds at my house.
Oh, yeah. The birds are taking
So
over.
if you do follow our Instagram, you would have went along with my bird journey. I had a bird's nest on my front door. We had babies. They left a huge mess. I'm over birds now. I no longer like birds. I thought it was a cool thing to experience. It's not. I hate them.
Yeah.
And my mother-in-law got me a fern for my birthday, and they have now made a nest in my fern. So now my fern is dying.
Yeah, you got to save
So
the fern.
I'm going to keep watering my fern, and if I drown birds along the way, don't sue me. I can't.
I don't think anyone can sue you.
Take care of any more birds.
I think you just need to remove their source.
I don't
replant
know how.
it. Can you transplant a nest?
I can't get it out. It's so deep in the fern. I'll take a video when I get
you're
home.
Gonna need to take a video.
There was a little teeny tiny dead baby bird by our house yesterday.
Isn't it just sticks? It's not glued in there.
No, but do you know how intricate their nests are? Like, they intertwine them in the roots of the plant. Like, they are very meticulous with their nest making. We have, like, 0 trees
at our house, so I see.
Okay, yeah, I'll send you a video of how intense the nest is. Because it's not like, I mean, I would probably tear up half the plant out of the dirt if I took the nest out.
Oh, gosh.
Yeah, it's like in the base of the plant.
Is it a duck? Is it a ground bird?
It's a finch? Just a normal brown bird that flies around?
Oh, a ground bird. Like it's.
Oh, no.
We have some wild birds that lay their nests on the ground in our gravel driveway because their eggs match the gravel. It's very fascinating.
Oh.
But every year there's this mom who yells at me when I go near her nest.
Yeah.
She goes, "Rah, rah, rah," and then she runs away.
Yeah.
And I leave her eggs alone and I always find them and then it's a matter of a week and they're gone.
Oh.
I know. I don't know why they do that.
Well, my fern's hanging. It's a hanging fern, so it's up in the air.
Right.
It's not on the ground. So no, it's a sky bird.
It's
not a ground bird.
It's a flying bird.
Yeah. We do have ducks, though, walking in our neighborhood every once in a while, but they're not making nests. It's so funny. Jacob sent me a video because he works from home and his desk is right in front of the window upstairs. And he sent me a video. It's just one singular duck walking in our neighborhood because we have a pond and then the lake is farther back. But he, like, the caption was like, guys, where am I? He's just like walking through a complex. So we have stray
That's a
ducks.
Country bird in the city.
Yeah, we have stray ducks, but they don't do anything.
Stray ducks. I don't think a stray duck is a thing.
He was by himself. He was all by
a
himself.
loner.
Yeah.
Okay. Well, my peak is that I have a baby niece.
Oh, yes.
I don't think I said that.
No, you did not.
Yeah, she's a couple weeks old now, and she's so cute and smushy, and
she's tiny.
And yeah, she's a tiny girl. She was 6 pounds something. Yeah, and it's so fun. It's so cute, and I love babies.
Yeah, probably watching your sister too be a mom is cool.
Yeah. She's been going through it in the postpartum, but now she's like starting to get her light back, and you can tell she's enjoying it more now. So
that's good.
But yeah, she's so cute.
That's exciting.
I know. She's so cute.
Okay.
Yeah.
Are we doing a Tales from the Trench, Harrison? Or no?
I have texted you one just now.
Oh, okay. Do you want to read or do you want me to read?
I think you read the last one. So.
Okay. We're going to read a Tales from the Trenches.
What is Tales from the Trenches, Courtney?
It is unhinged stories that our listeners send us via email. The roundtable at, I don't know the email.
The Veterinary Roundtable at gmail.com.
Our name.
Okay. I don't know. I thought it was something different. So we want you to just send us your unhinged funny stories from VetMed or whatever. And then we actually read them on the podcast. And when we do read them, it is our first time reading them. So we are astonished as well as everybody listening at the same time.
Yeah, I was trying to figure out this order, but I think I got it now. Okay. Here we go. Hi, my name is Sam. I'm a recent graduate in animal science from MSU. Go Green. One of the very first times shadowing, we saw a fit-in appointment for a possible UTI in a cat. The owner said the cat has been urinating outside of the litter box. We go in the room and start a physical on the cat, and the owner goes into a story about how she had her grandkids over and has been remodeling different rooms in her house. She said the other day she gave her grandkid a Capri Sun while she painted a room. After the grandkid left, she saw a wet spot on the floor in the room she was painting. So she smelled it thinking it's Capri Sun, and it didn't smell like pee. So she decided to taste it and licked the floor. She then told us how it was definitely not a Capri Sun, and it was definitely pee. And that is how she figured out the cat was peeing outside the litter box. It took everything in my power to act like that was normal. And after leaving the room, we looked at each other like, what did we just hear and experience together? Thank you all for the advice and shared knowledge. I love listening while I work.
Okay, who licks carpets? I don't care if I saw somebody literally spill chocolate in front of me. I would not lick my carpet. I wouldn't lick any carpet.
I wouldn't taste it.
No.
Like, if it doesn't smell like it, just move on.
Right, just clean it. You don't need to taste it.
Yeah.
Like, if you're, I mean, she had to have had extra Capri Suns if she wanted one.
I just like,
well, it goes, people are fun.
People are fun.
What's the word I'm looking for? I don't even know.
It makes life interesting.
Yeah.
A little bit scary. A little bit.
It makes all kinds to make the world go round. There we go.
It makes our tales from the trenches have meaning.
Yeah.
This was years ago when I was a student working in a clinic, and someone shared the story, right? So this is like multiple people removed, but they had a kitten, and sometimes cats, depending on kittens, how young they are, their mother's involvement, they need help to stimulate to go to the bathroom.
Yes.
Well, how the mom does it, licks the bungholio around that with her tongue and tries to stimulate it. Well, apparently this owner did it with her tongue. I'm not kidding you. I'm not making this up. This is a story but yeah.
I have no.
So every time I just had to recommend to an owner, if this small little kitten they found does not go to the bathroom, you might have to take a cloth, like a
right with your hand,
washcloth,
right.
But I think of that story every time. It's
oh
disgusting.
my God! Oh,
I know
that just kind of makes me want to throw
it's
up
like
a little bit.
That tongue thing that people can put in their mouth and like groom their cat.
Yeah, I've heard people groom their cats. I don't get it. People have probably carried their kittens around too in their mouths like moms do.
Oh no.
I don't know. It's probably happened.
Just so many parasites.
Yeah, right. Right.
So gross.
That's disgusting. But yeah, the carpet thing, I can't imagine licking carpet. Like that makes me want to throw up.
She'd have a hairball.
Right. I mean, she has a cat, so there's cat hair in the carpet. So
also, how do you taste from the carpet?
Right. It's soaked in. Like, I don't want to think about it.
I have a lot of questions.
I think we're done.
Did she wring out the carpet and then drink it?
How do you wring out a carpet? You can wring out a rug.
Did she cut out a hole of a carpet, wring it out, and make a glass of pee? I think it's valid.
Oh my God.
Okay, well, thanks, Sam.
Yeah. Well, okay.
I mean, it's a little more subdued, but it's still gross.
Yeah.
It's subdued from the other ones we've had.
Yeah, that was the pretty mild Tales from the Trench.
Yeah.
Trenches.
But still has us thinking.
Yeah.
Okay. Well, till next week.
Yep.
The next one.
Yep.
Okay, we're going to go into cases. So we have an update on a case, and then we each have a case to share.
Mm-hmm.
So we're probably going to run out of cases now that we're going to share since we're on the same team.
We're going to run out of cases.
So
well, I have another doctor.
That's true. Yeah, you do work with somebody else too.
Mm-hmm.
We had actually a couple good ones the last 2 weeks too.
Yes, we've seen some weird cases.
We just can't forget
like
them.
Pulse has you seen weird, like they've all just been weird.
So we just need to write them down.
I know we really need to start. We should get a notebook and keep it on your desk.
Yeah.
Oh my God, brainstorming.
And then we just run over
let's
and write it down.
Yes, let's just get a case collection notebook.
Okay.
And leave it in your desk so it's a central place.
Yes.
And then we'll just write them down.
Because I feel like I just forget.
Yeah. Well, I don't remember what happened on Monday.
Right.
And it's only Thursday.
Exactly.
You're right.
Okay. So we'll do the update on, we talked about Violet. She was a large Great Dane that had bite wounds from her housemate. And our last podcast, we talked about how she had just come in the day before. And the bite wounds were so deep that I ended up closing all the deep ones, which, again, it's one of those like, do you not? The owner wanted me to close them. She didn't like looking at them. You know they're dirty wounds, so we flushed them. We got the dog on antibiotics, which then is supposed to help with any infection. Well, she had come back that day that we were doing the podcast, so I have more information. But she came back in with a different doctor because she had a fever and cellulitis, a big swollen leg. So she was hospitalized that day to bring down the fever. Part of those sutures, some of them were open to drain. It was cultured, pain meds on board, injectable antibiotics because we found out mom was not able to give her any meds. She didn't want to eat. She came back the next day with my team just to continue therapy in the clinic. So we put her back on IV fluids just for maintenance because she did not have a fever, which was great. Her leg was swollen. I didn't see it the day before. She was uncomfortable, it was warm, but what I did was open one of the most draining wounds and allowed it to drain. And we did fovea light therapy on them. And the most proximal one looked great. So we kept that closed. And the other one was draining just a little bit. So it was partially open. So we continued anti-inflammatory. She already had antibiotics in her system. She actually ate readily some cooked chicken for us. So we were happy about that. She didn't seem too down and dumpy. She wagged her tail when her mom picked her up.
She looked better to me than she did the initial day.
You saw her. Yeah. So she was walking around. She wasn't the greatest patient in general. She was just super wiggly. So hydrotherapy was really difficult.
Yeah, she's also, we mentioned that she's blind and deaf. So she's already more difficult to do treatments on.
And how heavy is she? Like 150?
150, 160, somewhere around there.
She's a big girl. So we continue therapy and obviously continue through the weekend, knowing that we probably, and I prescribed topical antibiotic ointment for the wounds as well. Unfortunately, came back into the clinic on Monday to find out she had passed.
Yep.
And legitimately could not believe it.
Yeah.
None of us could.
We got records from an ER clinic.
Yep. The other doctor who worked on our case could not believe it.
Mm-hmm.
It turns out she had a liver mass that ruptured.
Yep. And she was septic, according to the ER.
Which they didn't end up looking at the fluid.
I know.
But they did test her glucose, which can help.
Her blood work didn't look like, I looked at her blood work and I was like, that doesn't look
And she didn't have
septic.
a fever. She didn't have a fever the entire time.
So when Mom said that, I was like, I just thought when I talked to Mom before I saw the records, I was like, okay, whatever, it's a word. And then I looked at, I was questioning that too.
Yeah.
I was a little confused why that word kept coming up.
Yeah.
Considering she didn't look, it didn't look septic on paper.
Those dogs are super sick. I mean,
yeah.
Granted, I'm thinking through, like, if it was a focal abscess and it was consolidated, but still, your body, like, I feel like I would have seen more on the blood work or a fever or something.
Yeah.
But they did x-rays, so she went to the ER because she wasn't eating, she wasn't acting herself, she was kind of off on her own, and they did an x-ray and saw a huge, like, gigantic, mass effect. And then they did a fast scan of the ultrasound, and they were concerned about a hepatic mass.
Mm-hmm.
And the plan was going to be to hospitalize her because it was the middle of the night and send her to do a official ultrasound at a different specialty facility. But in the middle of the night, she started groaning, and the owner was like, that's not normal. I'm on my way back. And they scanned her again, and she had a lot of free fluid. So
it's just like a perfect storm.
Seriously, like, it's like, me and the other doctor, we were trying to, it doesn't make sense. If it is from these bite wounds, that was a very fast spread hematologically, like, through her system. But it's still, I can't make sense of it with the lack of fever and the improvement on the leg and the drainage.
Yeah.
And so it was just bizarre.
I think it was just a second, it was,
incidental.
It was completely unrelated.
I mean,
and it just happened to happen at the same time.
And then the other thing is, like, did the housemate attack her because they could sense something was off already? Because they had gotten along all that time before?
Yeah.
I don't know.
It's just a really crappy situation.
Yeah, it's shocking.
Mm-hmm.
So, not a great update.
No.
Still
she was only 1.5.
Yep.
Almost 2, I think, but.
She was a lemon.
Yep. She was a double Merle.
Yeah.
Great Dane.
That doesn't always bode well.
Mm-mm.
It was really sad for the owner.
Yeah. The owner did everything she could, though.
She did. That's it. That's the update.
Okay. Can we talk about my case?
Sure.
Okay. So, I don't know how old. 8-year-old cat, 7-year-old cat.
Yeah, 7. I think he's
7.
7.
Okay.
Yeah.
Middle-aged cat. Came in for a routine dental procedure with Dr. Jones, and she had to do a few extractions, I think, on the lower jaw, on the right side. So we actually use Nocita as dental nerve blocks at our clinic. And so everything went swimmingly. It was a great extraction. Everything closed fine, completely normal. He woke up normal from anesthesia, went home that night. And then a few days late, I don't know how many days it was afterwards. I want to say 2 days.
Her days are Thursdays, and I saw him on Monday.
Oh, okay.
Right? Yeah.
No. Tuesdays.
And he came in on a Friday.
Okay, so it was 3 days, 2-ish, 3 days post dental procedure. His owner had texted, and this owner is very, very observant of her cat. She's a very awesome cat owner. So she was watching it very closely, and had noticed he was kind of acting weird in his mouth area, and he kind of slowed down on eating, which was unlike him. And then he looked like he was like chewing on his tongue almost, or like something was bothering him, like he was trying to get something out of his mouth. And then she was able to get a glimpse of his tongue and noticed a discolored part on the right side of his tongue. And so she brought him in because she wasn't able to get a super clear picture or anything like that. So she ended up bringing him in for us to take a look at it. And we did have to fully sedate him because he is a more temperamental cat in the clinic. So we did IV or IM sedation. And then once he was sedated, we were able to fully open his mouth and notice that the right side of his tongue was necrotic. So he had actually been chewing on his tongue, and we believe it was from the nocita of being numb. Which it happens. It's not anything anybody did wrong. So we decided to fully anesthetize him, and we cleaned up his tongue. So we debrided it, and Dr. Duckwall used cautery on that side and got all the dead tissue off. It also, his bottom extraction incision had opened, so we just threw a couple sutures in that to reclose it because it was down to the bone because it was a dental extraction. And he went home that night. We gave him Zorbium. We did gabapentin, and was there a third one?
We called out prednisone. He was on Maloxidil.
That's right.
Waited the 3 days. And the reason why I did steroids is because we didn't know if it was some sort of adverse reaction as well. It also just, I mean, he was on Maloxidil and obviously wasn't covering pain, so we just switched it.
Yeah. So we just covered our bases on pain control so that something like that wouldn't happen again, and he could eat and things like that and recover. But we checked in with Mom, and he's doing pretty good. He's eating. She's wetting down his food, making it softer so he's able to eat it easier. And he's doing really, really well.
Yep.
So we have pictures.
Yeah.
So I'll probably send them to Harrison, and we can get those posted too, because it's
a nice little divot in his
it
tongue
was
now.
one of the worst smells I've ever smelled in my
so
life.
awful.
Like, I can handle a lot of stuff, but that smell of a dead tongue.
But then also the cautery of frying it. I had to walk away a couple times because it was like
burning flesh is not for the weak.
I love cautery, but that was awful.
Yeah.
Necrotic
tissue mixed with burning flesh doesn't make a good smell.
Nope. But he did really good. Well, we had to transition from sedation, obviously, to GA. But
yes.
Mom was great.
Yeah.
She was like, yeah, this isn't good.
Yeah.
I was like, yeah, no.
Like I said, she was very in tune with her cat.
Yep.
Got him in.
Yep. Yeah. So that was an interesting case. The pictures are cool. We'll show the pictures.
Yeah.
Okay. I've got a couple, but I think I'll do the puppy one. So we had a 10-month-old dachshund come in on Monday, and the owner said that over the weekend they started to notice this redness around his eyes and some like blister-like pustules that then broke open with some blood. And then that was Saturday. Then Sunday, his jowl became swollen. And so they had a vet friend who was like, it could be allergies or an allergic reaction. So start Benadryl, whatever. So then I saw them Monday in the morning, and it was, I mean, at first glance, you're like, oh, this is a swollen allergic reaction puppy. But what was odd is like the jowls were edematous, like the maxillary lips were edematous, but his lymph nodes were big and hard. And then around his eyes, the blisters had opened, and so it was like dried, like crusts around his eyeballs. The rest of his lymph nodes and body were fine. Oh, he had been licking at his prepuce, which was a little red and swollen. And then his temperature was 104.3, which is a fever, pretty decent fever. So I talked to the mom about like, for how long it's going on. And it's really the blisters and then that systemic fever. I'm like, I'm not convinced it's an allergic reaction to anything. And so I said, if he was still eating and drinking and playing, which was good. But I was like, let's just get his fever down with some IV fluids. And then I'm going to run some blood work to make sure I can, if I have to use a high dose steroid, it's safe and whatever. And then I would know too that I don't need an anti-inflammatory for a fever. So really I told her, I was like, sure, it could be an allergic reaction, or it's I couldn't remember the name at the time, but I was like, it's an autoimmune response that basically creates this inflammation, also known as puppy strangles. So it really, I mean, after kind of confirming in a textbook, it's puppy strangles. Like it was textbook on all the signs. But his blood work was fine. His neutrophils were a little high. I did a sample skin cytology of the pustules that had opened because it's usually a sterile inflammation process, and there were neutrophils everywhere. It was pyogram and lomatis inflammation, but there was still some bacteria present, which it was on the skin, but he was also rubbing his face, so it could have been a secondary infection. So I ended up throwing antibiotics for a short course at him as well. But the mainstay treatment is high immunosuppressive doses of steroids. And what you do is so we gave him an IV injection of Dex of that to get him started, continued with oral prednisone at 2 mg per kg once a day. And then what you do is you keep them there for about 2 weeks, and then 2 to 3 weeks, depending on the flare up. I'm going to recheck him at the 2-week mark. If he's all back to normal, we go a week past that, and then you slowly taper him off the steroid. Rare cases, I've had another case, but usually you just treat the flare up and that's it.
Mm-hmm.
And then if, of course, they have another flare up down the road, sure. But dachshunds have a predilection to it with their breed. We don't know why it happens. We used to think it was vaccines induced or something, but that's no longer the case. So anyway, it's usually a one and done treatment once you get it under control. Rarely do you prep the owner that it's a long-term issue. So
that's good, though.
we also have a picture of him.
We posted a picture of him on our story.
Yeah, he was sad.
It looked like he got stung by a bee.
Yeah.
His whole face was puffy.
Yeah.
He was cute.
But it's those pustules are classic. Do you see that?
Good to know.
Yeah.
I didn't really know what was going on with his case. I missed the whole thing.
And we got a text the next day from Mom that his swelling was all gone and he was doing great.
Yeah.
So he'll be fine.
Yeah.
Prognosis is good.
Good. Yeah. I don't like the name of it.
Puppy strangles?
Yeah.
That's
just like where did that come? Is it because, I don't know.
Well, that's strangles.
Yeah, because it's swollen there.
That's not the official name. That's what I always call it. Let me look.
That's what I was taught. Like, that's what everybody knows it by.
Yeah.
It's just such a horrible name.
Medical term. I forget.
Not layman's term.
Juvenile cellulitis.
Oh.
That's kind of boring.
That is very boring.
We like puppy strangles better.
Yeah.
Yeah. Okay. Idiopathic
He's doing
skin
good.
disease.
So 2 good cases, 1 bad. But that's okay.
Well, it's his life.
Yep. 'Tis life.
Now what?
I think something that you guys should touch on is Courtney's video that we posted yesterday on our Instagram stories for the roundtable. I feel like a lot of veterinary professionals feel that way.
Oh, you got beat up.
Oh. Yeah.
Yeah, it's funny you say that because I was looking at my knee this morning because my knee hurts and it's all bruised.
Yeah.
I mean, I'm not on the ground as much as you, but
yeah,
it's real life.
Yeah. I'll get home. So I shower every day.
Wait, before you start, why don't you explain what that video is in case not everybody saw it?
Oh, well, if you don't know what it is, you need to go follow our Instagram because if you did, you would know what it is.
Be a true fan.
Yes. So there's just some days, I was just talking about how there's some days where I just feel like all of my patients are against me and they're very tiring days and you just get beaten down pretty quickly when every single one of your appointments, you take them to the back and the dog is just not happy or the cat and they're all just angry and they don't want to be at the clinic and they're overly stressed and then you get stressed because your patient's stressed and then they lose it and then they beat you up.
It's a roller coaster of cortisol.
Yes. Yeah. So it's just some days I can't win. I feel like I can't win. I'm like, my patients don't like me. Like it sucks. Or they're just, some patients are truly just aggressive, which is fine. But it's just, I had one of those days earlier this week and none of my patients were good. Yeah. It was a lot of them were annuals, but it wasn't just a straightforward, I take you to the back, I draw your blood, I give you your vaccines and you send you on your way. Yeah. It was we had to try 6 different restraint methods just to get one thing done on them. And they were all just failing. And then I got beat up. I'm covered in bruises. Those are just really exhausting days.
They are.
And like I said, it just feels like the whole world's against you those days because you're
well, then
I just need a break.
It takes longer. You get behind, which is also stressful. Yep. Or you need to be pulled in 5 different directions, but you can't because this one thing did not go well. Yeah.
And then you have to talk to the owner about drugs. Yep. And then sometimes the owners get mad at you and they don't like you telling them their dog was bad. Yeah. And I'm dealing with an owner right now who she's great, but she is really stressed because her dog tried to bite me. And this is the first time he's ever done that. But he was to his point of stress.
Yeah.
But she's having a really hard time. And now she's getting a trainer involved because she can't have an aggressive dog. So then it's those kind of situations that just escalate and they don't need to escalate. Right. And so then it stresses the owner out. And then sometimes they make it feel like it's your fault. And
I know. It's just hard. It's hard to try to explain to an owner the safety that has to happen.
Mm-hmm.
And obviously, the animal doesn't trust us. So it's hard for them to comprehend how this animal could not like someone or turn on someone. And then we're also doing things an owner will never have to do, usually. You're not going to poke, you're not going to restrain and hold off a blood vessel.
Yeah.
So it's hard to translate it, but then you also don't want to say, okay, you want to come watch it, because that stresses the owner out. It could upset them, but they don't understand the education behind the restraint method or the muzzle or whatever you have to do to get it done safely. So there's no winning in some situations.
Yeah.
And then when you're trying to advocate for the pet, where you see that threshold as being maxed out, and so you're just like, we're calling it. Then it's an inconvenience to the owner, and you feel bad about that. And then you're talking about drugs on top of this inconvenience of having to come back. And sometimes there's no way to win that battle.
Yeah. And it's just hard.
Honestly, some people get pissed and they leave because of it. And it's like, fine, like you can't jeopardize safety, but you also aren't going to jeopardize their pet's stress level. Yeah. Which is not good either.
Yeah. And then there's the owners that I get where they're coming from. At the same time, it's like, to your point, like when the owners are like, just hold them down. Yeah. I'm like, but we can't do that. Like, some patients do get stressed to the point where they could pass out, or it could turn into a medical emergency because we're pushing them to the point. And some patients stop breathing. Brachycephalic dogs can't hold those down because they will literally pass out. And like, I'm just like, I can't. And I'm not saying, like, our clinic, I don't think is necessarily certified fear-free, but we still try to practice fear-free because it's a great tool to use. Like, we're not here to torture animals. No. We're here for their health, and yes, we want to get things done, but our main goal is, we're their voice. Like, you can't just hold, like, no, a human doesn't want to be held down for stuff. Yeah. So, and it's still an animal. I know. It's just hard. Like, we had another example yesterday, Tuesday, another technician had a cat patient, and it was a younger cat, and it never had issues. And then all of a sudden it became aggressive in the clinic, and just like looking at the cat made it angry. And it was one of those that's like just screamed, like got to like that revving up scream and then was going to explode. And the owner chose to not give gabapentin correctly. And it was an owner compliance thing, but then the owner was also getting very angry because she had to bring the cat back. And so the tech's like, I really need to get this blood. So then we did push the patient a little too far, which I thought was wrong. I was uncomfortable in the situation because of how stressed the cat was. But it's like, you also want to please the client. Like, it was just because then we have that stress on us of pleasing the client because we don't want to upset them. Right. And so it's just a really difficult situation to be in.
Yeah. It just, those situations suck, especially when it's unexpected. You've never seen it from that pet before. Yep. And like, you try your best to work with it and kind of transition as the animal ages or things change. I will say it is also so nice when you have an owner that is fully trustworthy, they're trustworthy in compliance, but they trust us. So yesterday we had this very known fear aggressive lab that comes in once a year because she's otherwise healthy so far. And one of the first instances when she became an adult is that she became extremely aggressive because she's just so scared. But we were able to walk through it. That was a different team that had handled that situation. So when we took it over, we're like, well, we're going to see what we can do because the owner wasn't really like that pleased with meds, like didn't want to do it if we didn't have to. And we figured out a method and we get things done. She just stands there. We muzzle a basket muzzle for safety so she can pant and stuff, which I think helps her. But we get it done. And she's shaking, she's scared, but she's not like trying to bite us. She's not trying to run away. We're not holding her down. So there are situations where when you figure out the method, just don't change it. Yep. And the owner is pleased when you get it done, and we are honest and say it went really well. Yep. There are very few patients that truly just do better with the owners, or we trust the owners to hold them. Yes. And those are also really nice when you're like, I know this owner is going to protect me, and it's better in this situation to have that animal with the owner. Usually it's dogs. There's not usually cats. Yeah, no. Cats are too risky. If you get bit by a cat,
they're also really fast.
Yes. Yes. Yeah. We don't really do that with cats because
I think I've done it once or twice here and there.
Bigger liability, I think, honestly. Yeah. But yeah. I don't know.
Yeah. Scared animals are stressful. And also, I think a big point to say is that if you have the time to work with a patient, do it.
Mm-hmm.
Don't rush things, because we have seen, I mean, I don't know about other teams, but I feel like our team in particular, we get a lot of nervous dogs that have come from other clinics, and the owners are unhappy with previous clinics because they've ruined the experience for the pet, or like I'm not blaming other clinics, but I think sometimes we do rush things. And I mean, sometimes it has to happen that way. Not everybody's schedule allows for an hour appointment. You have to get things done, which I totally get. But if you have the time, take the time to work with patients. Like we've had a pity patient. She's been our patient for like 5 or 6 years now. And if we looked at her before, she'd lunge at us, and now we can do whatever we want to her. Like, so I think it's worth it. And like you said, you earn the owner's trust, and then you build a great relationship, and the pet trusts you, and then everybody in the situation is happy. So if you can take the time to work with a pet, do it, because it's also very rewarding.
There was, I think there was a comment in one of our podcast videos one time of someone being like, how do you have the time to block off an hour? Well, you just make the time. Like, you just do it. You know that you're not going to get, that means you're not going to get 2 or 3 extra appointments depending on how long your appointments are. Who cares? Like, it's worth it in my mind I would rather do my job well and lose those couple appointments than do it poorly, lose trust, lose a client, get bit. I don't want to get bit.
Right. Right.
So to that person who commented, how do you have an hour? Well, you make it an hour.
You make time.
You decide and you do it. And if you work at a clinic that's allowing you to do that, that's great. And if they don't allow you to do that,
advocate for your patients.
There's a bigger problem. So
you're here to be the animal's voice. Do it. And then you're just making it worse for everybody.
I know.
If you don't.
I know.
Then nothing gets done.
Snowball effect. Okay, well.
Is that good?
Thank you for coming to our TED Talk.
I think I could harp on behavior all day long. I love behavior.
See,
I could specialize in behavior.
Part of me hates dealing with it because
you have to have patience.
Yes.
Which gets frustrating at times, but it's like it's so rewarding.
And it's so intricate. Like, I do my best to walk through things with behavior, but it's like, I'm not in your house. I don't know what I try to envision the environment, but if your dog's aggressive at the door, I can't help you in your house.
There's other people for that. Behaviorists.
I know. That's when we refer to trainers and behaviorists and such. But
I just like gaining dogs' trust. It's fun.
I know. When you have the time, it's nice.
Well, yeah.
Hence the hour appointment. So nobody else gets stressed.
Oh, gosh.
Thank you for tuning in to another episode of the Veterinary Roundtable. Remember to like our stuff, subscribe to our stuff, and follow us. We'll see you next time.
We hope you liked this unhinged episode. It was a mess.
Until next time.
Goodbye.